Hello, how are y'all doing? Today we're going to talk about the mouth and specifically herpes of the mouth. Usually you don't need a biopsy to diagnose herpes of the mouth. Usually the person will have itching and they'll have vesicles forming around the mouth. But I think knowing what herpes looks like is very important. If we know it in the mouth, then we kind of know it where it presents anywhere because it has pretty specific features. Thank you to Pathpresenter for this case. So what we see here from low power, this is just kind of artifact. It's not actually from the mouth, but this is some squamous epithelium. And the way you know it's oral mucosa, it shouldn't have a prominent or any granular layer, and we don't see that here. What we do see is some stripped epithelium here with some fluid buildup and inflammation. So this thing is not happy, and kind of makes sense that like there's kind of splitting. It's kind of hard to determine if this is from the artifact or it's actually from the patient, but I mean, you do get open sores where the epithelium is not covering the sore in the patient. So here we see a lot of spongiosis with the spacing around it, but at this point I can't really call it herpes. I can just call it kind of reactive epithelium and try to look for herpes, other viral cytopathic effects, fungus as well. That's where clinical history would really help us pathologists kind of hones in on what to look for. But yeah, we see a lot of acute and chronic inflammation, maybe a little bit of necrosis as well. And here, this, from first glance, you might think, oh, this kind of looks like cancer because the cells are enlarged. They look atypical. They're dark. They have the nuclei are enlarged, but the cytoplasm is still kind of proportionally enlarged. So what's circled here is, if you don't know, you're gonna have to sketch it in your memory, but there's 3 M's. Molding, margination, and multinucleation. What we see here is multinucleation. What they mean by margination or molding is these cells are pushing against each other. They're not respecting each other's spaces. Kind of like, I don't know, I like to think of it of UDH in the breast. And then the last thing is margination, where the chromatin and the nuclei kind of marginate to the sides. So it's not, it's hard to get a really good example, but maybe here, some of the chromatin is marginating on the side. So if the sides are darker than the center of the nucleus, then that's margination. So this is herpes of the mouth. There are 2 main herpes infections, HSV1, HSV2. HSV1 can cause herpes encephalitis, usually in the temporal lobe in older individuals. It's often idiopathic. HSV2, if it gets in the CNS system, it's associated with this meningitis called Mollaret meningitis, and the reactive cells, the lymphocytes, I think, they look like footprints. HSV2 classically is associated with lower, anal genital regions, and HSV1 is more in the face. So just some board fodder, and if anything else, if there's only one thing you learn from this, just the 3 M's: molding, margination, multinucleation. All right, I'll see y'all tomorrow.